Hello, my name is Roxana Cruz, and I will be going over syphilis. Syphilis is a common STD caused by bacterium Treponema pallidum. It can be spread through vaginal, anal, or oral sex, and can cause serious health problems if not treated. Syphilis is divided into different stages, such as primary, secondary, latent, and tertiary, and there are different signs and symptoms associated with each stage. I will also be going over congenital syphilis and want to note that syphilis is not spread through casual contact, such as hugging, sneezing, or sharing towels. In the primary stage, a person may notice a sore or multiple sores around the original site of infection. These sores typically last 3 to 6 weeks, and they will go away whether they are treated or untreated. They usually occur near or on the genitals, around the anus, or in the rectum. They can also be found in or around the mouth, and sores are round and firm. They sometimes go unnoticed because they are painless. And if STD isn't treated, the body will enter the next stage, which is secondary stage. In the secondary stage, one may experience a skin rash, swollen lymph nodes, and a fever. And still at this stage, the symptoms may be mild and an infection may go unnoticed. In the latent stage, there are no signs or symptoms. It is also known as the hidden stage. Symptoms from primary and secondary disappear, but the bacteria is still present in the body and can last for years before entering the next stage. In the tertiary stage, by this stage there are severe medical problems, and this stage can be life-threatening. Possible tertiary symptoms include blindness, deafness, mental illness, memory loss, soft tissue or bone destruction, heart disease, or neurological disorders. Congenital syphilis occurs when a mother infected with syphilis passes the STD on to her baby during pregnancy. And congenital syphilis can cause a miscarriage, stillbirth, prematurity, low birth weight, or death shortly after the birth. Babies born with congenital syphilis may suffer from deformed bones, severe anemia, enlarged liver and spleen, jaundice, brain and nerve problems like blindness and deafness, meningitis, and skin rashes. Prevalence and incidence in the U.S. In 2017, the total case count for reported syphilis of all stages combined was the highest recorded since 1993. The total numbers of cases reported to the CDC increased 15.3% from 2016 to 2017, and in 2017 to 2018, more than 115,000 cases were reported. So as we can see, the trend is increasing. There are higher rates of syphilis reported in the U.S. According to the CDC, men account for most cases, with the vast majority of these cases occurring among men who have sex with men. And as this pie chart shows, almost half of all reported primary and secondary syphilis cases, at least in 2018, were from men who have sex with men only. So this is a map of the cases reported of syphilis per region. So we can see the darker areas are higher reported cases of syphilis. And prevention. The only way to avoid syphilis is through abstinence, and one may reduce the risk through monogamous relationships. That is, if both partners are monogamous and they are both negative from syphilis. Another way is to use latex condoms. This can reduce the risk only if the condom covers the sores. One should avoid recreational drugs because the misuse of alcohol or other drugs can inhibit judgment and can lead to unsafe sexual practices. If one does test positive, sex partners, including current partners or any other partners within the last 3 months to a year, need to be informed so they can be tested and treated as soon as possible. Treatment. If diagnosed and treated in the early stages, syphilis is easy to cure. The preferred treatment for primary to early latent stage is benzathine penicillin. 2.4 million units are administered intramuscularly, and for tertiary stage, the medication increases to 3 doses. This antibiotic medication kills the organism that causes syphilis. And there is a form of penicillin for pregnant women. that can be administered. So here's a resource, the Long Beach Health Center. I also included that Planned Parenthood allows one to make appointments online 24/7. Or I also included this HIV and STD hotline, and this is their phone number and their hours, and they also noted that all conversations are confidential. And here are my references. Thank you.